name's Nora. I'm going to be your nurse today. We're just going to go over a brief history and talk about why you are here today. Can you please state your name and date of birth?
Morgan Brandon in 2297.
Okay. And your vital signs look normal. And everything looks good. Your blood pressure's in a normal range. Your temperature's in a normal range. Your apical pulse is in a normal range, and your oxygen and respirations are in normal range. So why are you here today?
Pain in my left knee.
Okay. And when would you say that this started, the pain?
About 2 weeks ago.
Okay. And what would you characterize the pain as?
Sharp and throbbing.
Okay. And out of a scale of 1 to 10, what would you rate the pain, 10 being the worst?
It's between a 5 and 7 usually.
Okay. And where would you say the location is? You said left knee. Does it radiate anywhere?
Yeah, it goes up into my thigh in front of my lower leg.
Okay. And what would you say, how long has this been going on for?
About 2 weeks, and it's getting worse.
Okay. And what are the factors that make it more painful?
Squats, kneeling, exercising. Going upstairs is hard. Standing for long periods.
Okay. And then what are some relieving factors that you would say?
Ibuprofen, resting, ice sometimes helps.
Okay. And do you have any associated symptoms like trouble with doing activities of daily life?
Yeah. Kneeling, squatting, I'll aggravate it. As I said, stairs as well.
Okay. Cool. And so, seeing at your current medications, you take albuterol and Flovent 2 times a day.
Yeah.
Has those been working for you? Have you had any complications?
They've been good.
And your allergies are pet dander? Any other ones? Any other ones with food?
No, just seasonal.
Okay. And then have you, I'm just re-edifying, have you had any childhood illnesses like measles, mumps, rubella, varicella?
No.
Okay. And then when was your last flu shot?
December 2019.
Okay, so you're up to date on that, and you're up to date on all your other vaccinations. You've been going in and getting them routinely done. Okay, so have you had any past hospitalizations or surgery?
I've had my wisdom teeth removed.
What age was that?
14.
Okay. And then do you do well with stress?
Yeah.
Okay. Do you have good coping skills, good coping mechanisms?
Yep.
Okay. Do you have a good support system?
Yes.
Who is your main support system at home?
Girlfriend.
Okay. And you feel safe in your environment?
Yes.
And these are 2 questions that I usually ask everybody. It might be difficult to answer, but have you had any past history of abuse? Physical, emotional, sexual? No? Okay. And in the last 2 weeks, have you wanted to harm yourself or others?
No.
Okay. And so your family history, it says on your chart that there has been a medical history of arthritis. And so it says that your mother, 3 aunts, and grandmother have all had knee replacements. And you would clarify that that's true? Okay. And What activities do you like to do for fun?
Work out.
Okay. Anything else? Okay. How many times do you exercise a week?
3 to 5.
Okay. And you would say, how would you rate your current health status on a scale of 0 to 10, 10 being the best?
8.
Okay. So what is your usual diet?
It's good. It's healthy.
Healthy? Would you say you eat the good amount of vegetables and fruits every day?
Yeah.
What's your usual fluid intake of water per day?
It's usually enough.
Okay. What would you say is enough? How many water bottles a day do you drink?
2 to 3 of the 40 ounce.
Okay, cool. And do you drink alcohol?
Yeah, 3-4 times a week.
And what type of alcohol?
Beer, wine.
Okay. And how many things of beer and wine would you usually drink in a sitting?
2 to 3.
Okay. And do you smoke tobacco?
No.
Nicotine, vape, none of that? And do you use any recreational drugs?
No.
Okay. Do you wear contacts or glasses?
No.
Any hearing problems? Okay. And is there anything else you would like us to know about your health status? Any mental illness, any anxiety, any depression?
No.
Okay. So I'm just gonna ask you about your current 24-hour recall. What has your current appetite been in the last 24 hours?
It's been normal.
Okay, so you would say 3 meals.
Yeah.
Okay. And how much fluid would you say you drank in the last 24 hours?
2 of those water bottles, so 80 ounces.
80 ounces. And when was your last, when did you last void? When did you last urinate?
Half hour ago.
Okay, and then when was your last bowel movement?
2 hours ago.
Okay. And your activity tolerance with your knee pain, has it been less?
Yes.
Okay. Have you noticed a direct correlation with your knee pain and being able to exercise?
Yes.
Okay. And how much have you slept in the last 24 hours?
7 hours.
Okay. And I think that is it. Thank you. Hi, my name is Nora. I'm going to be your student nurse today. Can you please verify your name and date of birth?
Morgan Bender, and then 2297.
Just going to check your wristband. Okay, everything checks out. So today I'm going to be performing a head-to-toe assessment on you. We're just going to be going through all the body systems. So I'm going to first start at your head. I'm just going to palpate for any lesions, masses, any lumps. Then I'm going to look for inhabitants. So there are no inhabitants, no lumps or masses. And then I'm going to look straight on his face. His face seems symmetrical. There seems to be no disproportionate parts of his face. Can you puff out your cheeks for me? Can you smile? Can you frown? Alright, so his facial nerve is intact. Everything seems fine with his face. There are no open wounds. Nothing's wrong. It does seem that he has some acne scarring, so I would note that. And then I will go on to his eyes. His eyes seem like they're not irritated. They seem symmetrical to his eyebrows and the rest of his face. There's no discharge. It doesn't seem to be irritated. The sclera is white, and the eyelashes are evenly distributed. Can you please look up for me? Look at your conjunctiva. So conjunctiva was pink. There seems to be no problems there. And then you can just look right at me. So the corneal light reflex was equal in both eyes. And then I'm going to shine a light in your eyes. So just look right ahead. Up a little bit. So pupils were reactive to light, direct and consensual. And then I'm going to have you look straight at this pen and then follow it, don't move your head. Alright, so extraocular ocular movements were intact. There's a slight nystagmus, but nothing to be worried about. And then, can you read my name tag?
Yeah. Westminster College School of Nursing and Health Sciences, Nora student nurse.
Alright, so his vision is intact from about, probably say like 2 feet away. Okay, so then can I actually have you take your hand out and include one of your nostrils? So just hold one of your nostrils and breathe in. And then do it on the other side. So the right nostril was slightly occluded compared to the left. So the patient seems to have that. And then I'm going to go on to the ears. So I'm going to be looking for any lumps or masses or lesions. It seems like he has no scarring. There's no skin breakdown on the back of his ears. And then I'm going to look in your ear. So there is no unusual discharge, doesn't seem irritated, there's no drainage. There is just a mild amount of cerebrum in his ears. And then I'm going to do the finger test, so I'm just going to have you close your eyes. And I'm going to rub my fingers, and you should just tell me where you hear the sound.
Left, right, both.
Alright, so patient's hearing was intact, was able to let me know where he was hearing the fingers. And then I'm going to actually have you, I'm just going to be looking at your lips. So his lips are pink. There seems to be, they're moist. There's no lesions around the mouth. Can I have you open your mouth? Alright, and then, so his teeth are intact, open even wider. His buccal mucosa is pink and moist. His tongue seems moist. His throat does not seem inflamed. There's no redness. And I could not see his tonsils. And then I'm also going to have you open up again and say ah. Say ah. Alright, so his uvula was protruding midline, and he was able to do the scalp. Alright, so then I'm going to move down to your neck. And then what I'm going to do is you can just hold it like that. So your trachea is midline. I'm going to have you swallow. So there was no difficulty swallowing, no pain. Alright, so the trachea was moving. There was no difficulty swallowing. And then I'm going to palpate your lymph nodes. So there was no pain or tenderness with that. I was not able to palpate the lymph nodes. There was no unusual enlargement of the lymph nodes. And then I'm going to look at, I'm going to auscultate your carotid arteries. Let's have you look. Alright, so no bruits were heard bilaterally on the carotid arteries. I'm going to have you look up a little bit again. I'm just going to palpate. So pulses were equal in strength, 3+ out of 4 bilaterally. And then for JVD, I would have him at a 45-degree angle, and then I would have you go like this with your neck and up, and then I would be able to see if there was any distension or any abnormal pulses, and then I would have you do that on the other side. And it's a lot more noticeable at 45 degrees, but we just don't have a bed to do that. So then what I would do is I would move down. I'm just gonna have you put your arms out for me. All right, so by looking at his arms, his skin is normal. There seems to be equal distribution of the hair. The temp seems warm. He doesn't seem cold or too hot. The texture seems moisturized, doesn't seem dry. His musculature seems normal. There's no contractures in his fingers. They seem to be normal. So I'm going to palpate for edema. All right, so no pain, edema, and then I'm going to palpate your joints. Just tell me if there's any pain or tenderness. No pain or tenderness with that? All right, so no pain and tenderness. Can I have you hold out your arms? Flex them. Raise them up. So patient was able to use active range of motion. There's no pain with that. Okay. And then I'm going to have you push up on my hands and then push down on my hands. All right, so patient's strength was 5 out of 5. And then I'm going to look at your fingers. So his nail bed seems smooth. There seems to be no lesions around them or breaks. His capillary refill time is less than 3 seconds. I'm actually going to have you go like this with your fingers. Push them together. All right, so there's no clubbing present. You can stop with that. There's no clubbing present. It seems that everything is fine with his fingers, and then I'm just going to palpate your radial pulses. So his pulses were equal bilaterally, 3+ out of 4. And then I'm going to move on to your chest. So what I'm going to do is I'm going to palpate. Tell me if there's any pain or tenderness. And his skin looks normal. Normal color for his ethnicity. And it doesn't seem like there's any lumps or masses or lesions or scars. So everything seems fine with that. And then I'm actually going to have you sit up so I can look at your back. Slouch up a little bit. And then I'm going to palpate the back of his thorax, noting any lumps, lesions, scars. Let me know if there's any pain or tenderness with this. Alright, you can sit back now. So any pain or tenderness with that?
No.
No? Alright, so what I'm going to do now is I'm going to listen to your lungs, and I'm going to have you take a deep breath in every single time I move my stethoscope. Okay?
Breathe in my nose or no?
Breathe through your mouth, please. Alright, so lung sounds were clear anteriorly, and then I'm going to have you scooch up and sit up again. It's just, yeah, there you go. And then I'm going to listen to them on your back. Just take deep breaths through your mouth. Alright, good. You can sit back. So lung sounds were clear in all lobes. I didn't hear any crackles. So everything seems clear there. And then what I'm going to have you do is just breathe normally. I'm just going to be counting your respiratory rate. So your respiratory rate was 12 per minute, so that's a normal range. We're looking for around 10 to 20, and then I'm going to have you I'm just going to open this up, and then I'm going to inspect your chest. I'm just going to listen to your heart sounds. Okay. Alright, so normal heart sounds with the bell and the diaphragm. I was able to hear S1 and S2, and I didn't hear any extra heart sounds like S3 and S4. And then it's gonna take a long time, it's gonna feel like forever, but I'm gonna listen to your apical pulse for 60 seconds. Alright, so your apical pulse was 60 beats per minute, so that seems normal. And then what we're going to do now is I'm going to have you lay flat because we're going to inspect your abdomen. So as flat as you can go at this moment in time. So what we're going to do is I'm just going to inspect it. The abdomen looks symmetrical, the umbilical's midline. The temperature is warm. There seems to be no moisture. There's no scars, no lesions, no masses. The musculature looks normal. So what I'm going to do is I'm going to listen to your vowel sounds. So vowel sounds were normal. There's about 5 gurgles in each quadrant. And then what I'm going to do now is I'm going to palpate. I'm going to go light, then deep. And just tell me if there's any pain or tenderness with what I'm doing. Any pain, any tenderness? No. Okay. So patient states no pain or tenderness. I didn't feel any organ enlargement. There was no distension of any kind. So then I'm going to have you just sit up again. And you can sit back. Alright, so then I'm just going to raise your pant leg up. And then I'm just going to be looking at his legs. So normal temp, normal skin color. There seems to be no type of lesions. He seems to have a few scars on both knees. But other than that, it seems good. I'm going to inspect your pedal pulses. Okay, so pedal pulses were equal bilaterally, 3+ out of 4. And then I'm just going to check your cap refill time. So cap refill time was 3 seconds. His feet feel kind of cold, so that could be also the reason because of circulation. The nails are smooth. Doesn't seem like there is any problem with them. And then what I'm going to have you do is move up close, up to the end of the bed. I make you move a lot. And then I'm going to have you push against my feet, flex, and then I'm going to have you extend. Okay, so strength was equal bilaterally on his feet, and then I'm going to have you push in, and then push out, and then push up. So strength was 5 out of 5 on all extremities. He was able to do all of that correctly. And then what I'm going to have you do is just scooch back a little bit so then I can have feet off the ground. So I'm going to test your patellar reflex. Okay. This might not work, but okay. Okay, so patellar reflex was 2+ out of 4, and then I'm going to have, let me get this. Okay, so Babinski reflex was negative. patient's toes curled in. And then what I'm gonna have you do is I'm gonna have you get up. We're gonna have you walk. All right, so I'm gonna have you walk in a straight line that way. And then turn around and come back and walk on your toes. Okay. And then I'm gonna have you can put your shirt back on if you would like. So patient had a smooth, stable gait. There was no wobbling, and he was able to do that. And then I'm just gonna have you stand with your eyes closed for 20 seconds with your feet together. All right, you're good. So Rombark's test was negative, and then I'm gonna have you turn this way and then bend down. And there seems to be no spinal deformities.